Why it's not the same to treat a normal patient or a healthy patient in a dental infection than have an abscess in a patient that is immunocompromised? What do I mean with that? If it's a dental infection in a patient that is immunocompromised, we have to take action immediately. You cannot wait, and why you cannot wait is because the circulatory system that we have in the neck, a small cavity, there's no defense in the organism, so that small cavity is going to travel to the canals, and from the canals will go to the vascular system of our body, can dehydrate the bone, can affect the gums, inflammation, and many other disorders. Let's see what we're going to learn today. I am Dr. Fanny Yacaman, and today we are going to talk on a very serious episode, which is how do you treat a patient with a dental infection when he's immunocompromised. So if you have any immune disease, you're going to learn today what to do, where to go, and what recommendations I'm going to give you. If you suffer of any immune disease or any one of your friends or your family, it's very important that you share this information. Why? Because the immune system is our shield. It's like we have a protector against any disease, any bacteria, or virus. That's why during COVID, many people that have some immunocompromised systems in the body were dying faster or immediately because the immune system was not in the strong level that we have to have. So if you have cancer, HIV, no control or poorly controlled diabetes, hemophilia, that is a blood disease, Sjogren's syndrome, that is more than a dry mouth, you have to seek a doctor, your dentist, and if it doesn't get better, you have to seek immediately attention at the hospital. So a deep cavity, like in this case, you have a deep cavity. An abscess, like you can see in these images, is a dental abscess. The gums get extremely inflamed in the fastest way when you have an immune disease. Then you have to seek immediate attention. Why? Because in a normal patient, it could be that it doesn't spread to the whole body, but in patients, if you have an immunocompromised patient, then this can spread easily to several parts of the body, especially sometimes to the heart, to the lungs, and most of all, that once you get a septic shock, you get to the hospital, sometimes you cannot be saved. So you have to remember these details. And why I'm doing this comparison? Because in a healthy patient, if you have an abscess of this type, the body will help you at the beginning. During inflammation, the patient is going to have extreme pain because the pus has to come out, or they see immediately they said, oh doctor, I have like a pimple in my gum. That is a sign. And in a healthy patient, most of the time you have the symptoms very clear. Sometimes in a patient with an immune disease, if you suffer of any of these immune diseases, then what happens is that you sometimes don't feel anything. And the disease that is spreading is going very silent, bacteria is very sneaky, virus is even worse because they're very smart, and the infection is start spreading in the easiest and fastest way in the whole body. What are the most important warnings in a patient that has an immune disease? If you suffer of that, then you're gonna find that you have either no pain or persistent pain that is worse and worse and worse as the time goes. You can have swelling of the gums, you can see pus coming out, sometimes you can have a bad odor, sometimes not, but you can feel a liquid coming out of your gums. You can have fever extremely high, you will have fatigue, and in general, like the whole body is an overall in a weak stage, which is gonna make you feel weak, And also, if you have difficulty to open your mouth or an excessive amount of swelling or a little swelling, that is one of the very important warnings that you have to seek attention immediately. If you don't find your dentist or your endodontist, go to the hospital. So listen to these practical recommendations I'm going to give you. Number one, if you have to go to your dentist every 6 months or every year, try to go every 3 months. Try to have very well scheduled your dental cleanings. Always inform your dentist of your condition and what medications you're taking. And at the first discomfort that you feel in the mouth, seek immediately attention from your dentist, endodontist, periodontist, or the hospital. That is very important. And remember, prevention is the key. Regular cleanings, in a timely manner, you're gonna get your appointments so they can do a diagnosis. You can be on time to prevent any serious disease or any serious complication that can take you to death. Taking care of your dental health, the result is that you're gonna maintain an overall health of your body. Because remember, the food that we eat, the first step is entering through the mouth. So you have a healthy mouth, a good nutrition, lower your amount of sugar intakes, have a good cleaning, you will maintain your overall health with a good brushing technique and flossing that I have in my very first chapters, and many chapters I have repeated exactly the technique of brushing and flossing that you need to have every single night. And if you have any questions, I'm Dr. Fanny Yacaman. Don't hesitate to send me a message, contact us, that I will be ready to take care of any questions that you may have. Thank you.